So what we're going to demonstrate first is a couple different forms of deep pressure therapy that dogs can be trained to do. Some of these Sherlock knows, and some of these we're going to kind of show you as we go along. So the first is the most common, and that's sitting down. So for this, all it's going to be, I have treats with me to show you. So all it is luring into position. Okay. Sherlock, pause. Pause. So we're going to ask him to target the chest pressure points. And once he starts getting the pressure points, which are right about your collarbone, he's a little low right now, so I'll help him reposition. Right about your collarbone on either side. So this is typically the most effective, and then I just ask him to push his weight forward into me. So the most important thing about deep pressure therapy is that it's cued, and he gets off on command, unlike he just did. But he's getting a little impatient with me talking. So Sherlock, pause. Pause. Right here, right there. Go ahead. Okay, off. Good. So the next common form of deep pressure therapy is targeting pressure points in the legs. This does not work for a lot of people, but it is important that they target the pressure points in order to make it count for deep pressure therapy. So it's going to be the same concept of luring the dog forward. Sherlock, pause up. Pause up. Pause up. Good. So the pressure points are right in your thighs. So all I'm going to do is position the dog exactly where I want him. And when he's in place, I'm going to ask him to hold it, and I'll treat. So if you use markers or anything like that, once the dog makes contact with the right spot is when you're going to mark and treat. And then the same thing as before, that he needs to get off on cue. Sherlock, off. Good. Another common one is going to be from the side. So we'll lure from the side, and this is one we almost never use. So it's just going to be luring up. So see, he's used to coming to the front. So I'm going to lure him around. Pause. Come. Pause. Good. So this does not target pressure points as much, and is a lot less likely to be considered deep pressure therapy. So just something to keep in mind. So the next position we can do from is sitting on the floor, which is very common if you're out of a store or someplace where there's not chairs accessible. So typically what I'll do is slide down the wall, and this is one where he does come from the side. So I'm going to have him come around. I'll lure him across my body. Sherlock. No, not down. Come. Ready? Here. All right, poodle. Hey, do this. Let's go. Pause. And he's going to get the treat when he drops his bottom. Depending on the dog, you'll get more pressure if their bottoms are up or down. Sherlock, down. Drop your butt. Thank you. And then we'll maintain the position until you're ready to have the release, and you're going to give him the off cue. Sherlock, off. Good. So lots of treats through the training process. The last one we're just going to touch on real quick is going to be standing. So for the standing, all we're going to do, pause. Sherlock, pause. And we're going to ask him to target those pressure points in the chest again. If you have a slightly smaller dog, typically I'll come down just a little bit so that he can actually target those points. Here, poodle, come. There you go. So I want him to target those points and hold until I ask him to get off. Off. So that's a little bit about deep pressure therapy and the different ways that you can do it in different positions.